Let's talk about falls. What are the risk factors for falls in an elderly person and how to evaluate him? So first, the risk factors. If a person has a previous history of fall, that simply increases his risk of fall again. So if there is any history of previous fall, then as the person ages, the risk of fall increases. So anyone over 80 has a high risk of fall. Then comes with the nervous system function, starting with any cognitive impairment. If the person has a cognitive deficiency, cognitive impairment, such as dementia, that increases risk of fall. And same goes with depression. If the person has cognitive impairment, if the person has depression, that increases the risk of fall. Then if the person's vision is poor, he can't see, that increases the risk of fall. In the cardiovascular system, if the person has orthostatic hypotension, that's another risk. In the musculoskeletal system, if the person has weak muscles are weak, if there is gait problem or balance problems, and if there is joint disease such as arthritis, then all of those increases the risk of fall. If the home is not well organized, that increases the risk. And there are some drugs which impairs the function of the brain and impair the function of the overall systems that can increase the risk, such as drugs such as ACE inhibitor, nitrates, sedatives, those kind of drugs. Even the drugs such as antidepressants can increase the risk of fall. Next up, the clinical evaluation. So we have to take history according to the risk factors and then examine the patient. So in the clinical examination, in the cardiovascular system, we have to examine for postural hypotension. In the nervous system, we have to do a thorough nervous system examination, including a structured cognitive assessment, such as using MoCA or mini mental state examination, MMSC, MoCA or MMSC. And we have to examine the sensation, examine the vision, and examine the musculoskeletal system, examine the functional status. And after the clinical evaluation, we'll do a relevant investigation according to the history and examination findings. But some common investigations would include the laboratory evaluation for example, common ones, the CBCs. Do the CBC, try to find any anemia. If there is anemia, give blood or correct the deficiency. Try to find out an electrolyte imbalance. So electrolytes is the common cause of increasing the risk of fall. Do a blood sugar. You can also do serum vitamin D levels and additional investigations based on the patient's history and examination findings. But those are the common ones. I mean, do them in almost every patient.